Striding to the lectern now is Art Kellermann, who is a surgeon at the ER at Grady Memorial Hospital, Atlanta's public hospital. He's also professor of emergency medicine at Emory. And given that, as we know, so often the solution that the uninsured come to when they need medical care is to go to an emergency room, it is extremely valuable to us to have on the panel somebody who is at the receiving end of that process. I give you Art Kellermann.
Actually, I'm not a surgeon. I am just an ER doc, and I don't have the distinguished background of my fellow panelists, but I have treated thousands of patients, insured and uninsured. And I've also broken bad news to hundreds of families. I want to tell you about one of them that I'll never forget. It took them 2 hours to reach Atlanta from the North Georgia mountains. I faced them across the outstretched body of their son. The ventilator hissed rhythmically, 10 breaths per minute. I spoke first. "Your son was in a terrible crash," I said. "The ambulance crew could tell he was severely injured and called a helicopter. He reached us about 3 hours ago. He has several injuries, a collapsed lung, internal bleeding, but these aren't his most serious problem. His brain injury worries us the most." That's when his mother interrupted me. She said, "Doctor, I don't know how to ask you this, but I must. My husband lost his job 6 weeks ago. I work, but my employer doesn't offer health insurance. Is my son going to get the care he needs?" Momentarily taken aback, I replied, "Ma'am, you're at Grady Hospital, one of the finest trauma centers in the South. I swear to you, we will do everything in our power to save your son." I meant what I said that night, but I didn't tell her the whole truth. I didn't tell her that our best probably wouldn't be good enough, and that if her son survived, he'd probably be disabled for the rest of his life. I didn't tell her that she and her husband would be billed for the helicopter flight and the days or weeks to come in the intensive care unit, and that the total would probably reach $100,000, maybe a whole lot more. I didn't tell her that she and her husband would empty their savings and mortgage their home in an effort to pay the bill, and it wouldn't be enough, and that the coins put in a coffee can at the local diner wouldn't come close to covering the difference. I didn't tell her that the unpaid balance of her son's bill will push Grady Hospital closer to insolvency, closer to its own crash. And if Grady closes, North Georgia, a region of more than 5 million people, will lose its only level 1 trauma center, its only burn unit, its only poison control center, its only emergency psychiatric unit, and 750 inpatient beds. And that's not all. If Grady closes, Metro Atlanta's private hospitals, already overburdened by population growth, will topple like dominoes, one after another. Ladies and gentlemen, for me, this debate is not an idle intellectual exercise. It's about lives, 300 million American lives. I support this resolution for 3 reasons. First, because our failure to cover every American is a national disgrace. Second, because we'll never achieve universal coverage if we don't make health care in this country more affordable. And third, because the only way we can make health care more affordable and cover everyone is through a well-regulated health care marketplace. And to do that, the federal government must be involved. Now, let me be clear. The majority of Americans do not want a government-only health care system, but they absolutely want the government involved as a referee, as a cop, to make sure that everybody plays by the rules. The other side of this debate will try to convince you that rising health care costs are due to government interference. Well, they've got it backwards. The problem is not government interference with the healthcare industry. The problem today is healthcare industry interference with government. That's why the business of medicine is booming. Record profits, huge executive salaries, bonuses, healthcare costs spiraling out of control year after year after year. But the caring side of medicine is failing. On the front lines, doctors, nurses, and other healthcare professionals are nearly as frustrated as you are. The nationwide crisis in emergency care is a case in point. Every major challenge we face, ERs packed with patients, dangerously long waits to be seen, 500,000 ambulances a year turned away to more distant hospitals, and fewer specialists than ever willing to take ER call. All of them are due to the fact that the economics of healthcare encourage hospitals to favor elective cases over emergency patients. Good for business, bad for patients. And it's terribly expensive. Country music star Dolly Parton once quipped, "You have no idea how much it costs to look this cheap." The same can be said about American health care. You have no idea how much it costs to run this poorly. We spend $2 trillion a year on health care, and $1 trillion is a lot of money. Put this in perspective. 1 million seconds ago was last week. 1 billion seconds ago, Jimmy Carter was inaugurated president. 1 trillion seconds ago was 30,000 BC. For $2 trillion, we can take good care of everybody in this country and have a lot left over, and you don't have to look outside the U.S. for proof. If everybody practiced medicine as efficiently as they do in Rochester, Minnesota, and Salt Lake City, Utah, Medicare could pay 30% less to doctors and hospitals, and everybody would get better care. But it won't happen on its own, because one person's waste is another person's revenue stream. That's why we need a cop on the beat. And the only cop with the clout to get the healthcare industry to play by the rules is the federal government. My side has given you several reasons to vote for tonight's resolution, but the most compelling one of all is your own self-interest. Because a healthcare system that doesn't work for everyone may not work for you when the chips are down. Take it from me, an ER doc. No one can predict when a life-threatening emergency may strike. But if it does, you'll want your doctor to go the extra mile, not your ambulance.